Good morning, everyone. Okay, I welcome everyone to another new week. We continue on our book reading today. So, The Toyota Way to Service Excellence by Jeffrey K. Liker and Karen Ross. And we are still in chapter 6, which said micro principles. And we're in principle 9, which says use technology to enable people. Last week we looked at how important technology is for an entire organization. It is not meant to replace people, but rather it is meant for innovation, organization, problem solving, and the rest of it. Today on page 222, we'll be looking at technology fiasco in health system. Technology fiasco in health system. So one of my PhD students, Brock Hosby, spent years working as a lean healthcare consultant as he was getting his PhD. One engagement, which turned out to be part of his dissertation, was to help a statewide system recover from poor process of justifying and installing an automated centralized laundry system. Toyota's predominant approach to technology is to use proven, reliable technology applied to well-defined and understood processes. They prefer to test the simplest solution, often on a pilot basis, before deploying more advanced technology. Often, Toyota will delay new technology development until the site is ready, which means its processes are already lean and under control. The pilot program invariably reveals issues that the creators of the technology missed in the original design. Processes get fine-tuned and the technology is adapted to support the process. The hospital system that ultimately called Brooke in for help did the opposite. It had laundries distributed through the healthcare system, and they worked well enough. But the processes to use them were not well defined and definitely not standardized. An executive commissioned a financial analysis that showed the organization could save millions of dollars per year if it centralized the laundry in one common facility that did the laundry for the entire state system. By using the latest technology, it would need a minimum of labor. A total of $10 million was invested in a state-of-art facility. From the initial launch of the laundry, shortages of towels and scrubs were threatening to shut down the operating system at the main hospital, and the off-site laundry processing and on-site laundry distribution managers were not on speaking terms with each other due to animosity and finger-pointing about this poor system's performance. A fixed daily order for laundry was in place with no system to react to variation in demand other than expediting orders or stealing from other departments. The chief operating officer (COO) of the hospital was getting 44 calls a day from angry department administrators, and most hospital employees were frustrated with the new process and wanted a return to the old system. The $10 million investment, business failure, poor performance, technical failure, and low customer satisfaction, social failure, led to a call for help to Brooke. The people at the healthcare organization thought that lean thinking might bail them out. Diving into the Gemba, Brooke observed and interviewed people for weeks and worked with a team to map the current state of the process. And then the team came up with a shared future state vision and accompanying action plan. The team consisted of the on-site and off-site laundry managers, frontline staffs, industrial laundry technical staffs, truck drivers, and several internal customers. Broke facilitated the problem-solving process, but team members developed, implemented, and refined the process. As the project progressed, the capability of the team members increased as they became more familiar with the approach and began focusing on the process metrics that weren't available at the beginning of the project. This was obviously a burning platform, and after completing 147 of the 150 action items, the processes were working smoothly with no outages or calls to the COO. Also, the team reduced the workload per cat and improved other measures of efficiency. Frontline staff members who had never been engaged in creating their processes created a system of visual Kanban replenishment, that is a pull system, to adjust orders to actual usage. Core process measurements were established and actively used for ongoing problem solving. The off-site and on-site laundry managers, who were not on speaking terms initially, were now friendly and communicating multiple times per day to dynamically coordinate the flow of laundry. Improvements were not technically complex. An example of one of the improvements was shifting where the soiled lining was temporarily stored from the third floor to the basement. Before this change, the laundry staff had to take a heavily used elevator that only carried 2 carts to the third floor, which increased the number of trips and resulted in insignificant wait time for an available elevator. With the dirty laundry stored in the basement, a large freight elevator located at the loading dock could be used, which also greatly decreased the distance to be traveled to get to the elevator, which had a capacity for 6 or more cars and was only one level away from the basement storage room. This had a significant and immediate effect on the newly established metric of average time per cart. Unfortunately, this type of case is all too common, getting an abstract idea about the benefit of new technology, building a business case, and then deploying without deeply understanding the reality. When we introduce any complex technology, there is a great deal of uncertainty, and yes, technology providers often act like implementation is a routine process. Broke suggests a 6-step process to effectively introduce a new technology, which involves learning step by step as you go through PDCA. Step 1. Clearly define the problem or need. Step 2. Carefully elevate the process and improve it as much as possible before leaping into new technology. Step 3. Consider the skills required and develop a plan for training and involving the people affected by the introduction of new technology. Step 4. Introduce the new technology first on a pilot basis to learn and work out the bugs and the processes of introducing it. Step 5. Introduce the technology into other locations in a stepwise fashion, with local management taking ownership and leading the process. Step 6. Using an effective daily management system. Expect the people responsible for the work to continue to improve the technology and processes. So this is where we'll stop for our reading this morning. In summary, it's just talking about using technology in the healthcare system. And using technology in the healthcare system helps to learn step by step. You don't just introduce technology into a health system without anybody knowing how to use it. So Brooks in this passage suggested 6-step processes to effectively introducing a new technology, which is one, you have to clearly define the problems or needs of that organization. The second one is to carefully evaluate the process and improve it as much as possible before leaping into the new technology. So first of all, it's important to identify the problems before introducing whatever kind of technology you want to introduce into a system. Like he reminded us last week, technology is used for improving quality of service, reducing labor, improving creativity, and and functionality in an organization. So this is a summary of our reading for today. Thank you.